Hi guys, so we're doing the lateral rotators of the hip. This is a posterior lateral view of the hip with the lateral rotators, the piriformis, the superior gemellus, the obturator internus, the inferior gemellus, and the quadratus femoris. Enjoy the video.
Hi Juliet, my name is Sammy. I'll be your student physical therapist today.
Hi, how is it going today?
Good, how are you?
I'm okay. I'm having a little bit of hip pain and it kind of feels like I'm walking a little funny.
Okay, so why don't you sit down and you can tell me a little bit more about it. So what brought this pain on?
It's just been kind of growing over the last couple of months. I'm not really sure. It just sort of like is localized over here.
Okay, cool. So I noticed that when you came in, it looked like it was hard to kind of bear weight on that hip. So why don't we test some of the muscles that help you rotate that hip outward. The muscles that we're testing today are going to be kind of in your buttocks region, so it's a little bit of a sensitive area. Do you mind if I palpate those muscles? Or
That's fine.
Okay, great. So I'm just going to be testing those. I'm just going to lift this up a little bit and we'll get started.
Okay.
Okay, Juliet, so in this part of the test, I'll be pushing on your leg to test some of the muscles that rotate your thigh outward like this. Additionally, I'll also need to feel for those muscles as they're contracting. Those muscles are in kind of a sensitive area in your hip and buttock region, so is it all right if I feel over there?
Yeah, that's fine.
Okay. So in this test, what the motion that I'd like you to do is just kind of bringing your leg in like this. So you're rotating your thigh just like that. Perfect. And then the only thing I want you to be aware of as well is keeping your thigh on the table. So I'll be helping you to brace that thigh down as you move, but I also just want to see that you can kind of rotate without moving it too much.
Okay.
Okay, so the first thing, I just want to see you move on your own. So just go ahead and move that leg just like that, and I'll just be feeling over here for those muscles. Great. It looks like you have full range of motion on your unaffected side, so that's great. The next thing that I'd like to do is apply some resistance to see how you can resist my push. Okay, so I'm going to brace Juliet's thigh over here on the lateral side, and then I'll be applying pressure to the medial side of her leg in the direction of medial rotation of the thigh. Okay, so on the count of 3, I'm going to apply the resistance, and then I'd like you to hold for 5 seconds. I'll let you know when I start. Okay, all right, 1, 2, 3, resist, 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 and relax. Great. So that was strong resistance that I was applying to Juliet, so I would give her a 5.
All right, Juliet, so we're going to be doing your right side now. So what I want you to do is do the same motion that you did before. I'm just going to be feeling for that contraction again, so go ahead and move as much as you can. Ow. Okay, go ahead and stop. Great. So now what we're going to be doing is we're going to just make sure that that joint is moving okay. All right, so go ahead. Don't let me do, or don't resist me. Don't help me. I'm just going to move it for you. Okay, go ahead and relax. Great. All right, so what we're going to do is go ahead and lay down on the table on your back. Okay, just going to move the table down. Are you feeling comfortable?
Yeah, I'm good.
Okay. Now, can you go ahead and scoot towards me a little bit? Great. Okay, so go ahead and lay this leg down. Awesome. So I'm going to go ahead and raise this one up. I'm just going to kind of support you. So what I want you to do is once again move that leg or rotate your ankle towards the other leg, just like we did before. Whenever you're ready, go ahead and relax. Great. Okay, I'm going to move you back. I'm just going to apply some slight pressure, okay? Great. Okay, and relax. Okay, so because Juliet was able to do she was able to resist slight pressure in a gravity eliminated position, we would give her a 2+. Okay, so we tested the lateral rotators of the hip. So in summary, we tested Juliet's unaffected left side, we in a seated position, gravity resisted, and we gave her a score of 5. We then tested her affected right side in a supine gravity eliminated position with a score of 2+.